Well, disc replacement is actually removing the native disc or a diseased disc that's between the vertebrae and putting an artificial disc in there. And rather than doing the traditional fusion, now we have the ability to offer them a motion-preserving operation that is a disc replacement. We're doing something that is really next generation. Instead of just trying to fix a broken piece, we're actually trying to fix the broken part, but restore the function rather than take function away from the neck or the low back. Cervical artificial disc is quickly becoming the gold standard, where we used to say the fusion was the gold standard when you had a ruptured disc in the neck. No longer.